All right, welcome yet, our amazing viewers. We're having Andrew Mosiane as our guest today. This is just gonna be the second podcast as per usual. We would normally have a second segment, just a round of questions. Those questions that we're having, no one else knows about them except me. It's usually just general social stuff. Again, I just want to put out a disclaimer. This is not the views of our employers or those that have employed us before. These are our own opinions and how we feel and how we think and our experiences of things as paramedics. And we're just sharing this for general public and everyone else that watches our show. So I think the very first question is just Andrew. I know that you were making a comment about interviews, and I just kind of want you to include this in this segment because I actually really like your perception of it or your thoughts on it. That it's not really a true reflection of someone, it's just of that moment and that situation. How would you sort of like round it up if you just to share your thoughts around it?
Yeah, man. Like I was saying, there's something about interviews which is it's an unfortunate aspect, but it is what it is. It's a snippet. It's a 15, 20, 30 minutes conversation with someone that seeks to give you a perspective about what they're capable of, what they know, and their, you know, views on matters. So the unfortunate thing is that in most instances, whether it is seeking an employment, there's never opportunity for feedback on how you perform. The only feedback you get is did we employ you or not? And if we don't employ you, you never knew whether the way that you expressed yourself, engaged with the content, and the question was of satisfactory level to what degree, so that you can better yourself in the future. So it's an unfortunate part, but it is the reality in terms of interviews.
Yeah.
So at times we lose brilliant individuals just because they had a bad day or a few seconds before they entered something, affected them, or a day before, the moment before, and they lose focus on that particular 15 or 20 minutes chat.
Malusi, you had a couple of interviews. How did you find those?
Yeah, I've had a lot of interviews, but I think there's a lot that I can say around this space. There's one thing though that I have noted is that in other interviews you can do well because sometimes you associate with the panel in one way or the other, or they can identify with you as a person. Um, the socialization part, I'll make an example. If a person went to a university in South Africa and they finished working, they work for the government. Let's say they work in the Eastern Cape or KZN, where there isn't a lot of other races that you interact with, and then after that you try to get a job in a country like let's say Australia or the UK, and the interview panel is white people that are just Australian or I'll say from the UK. Your interaction with them, sometimes there may be that intimidation from the person who is a South African because they're not used to talking to those people and the expectation is not the same. I think it's sometimes the challenge will be to get the best out of a person because they're not comfortable around that space, or what is expected from a person uh, is not what they're getting because the person is not climatized socially around those people. I think it's one of the things that I've seen. Also, sometimes the age of the panel, you'll find that there will be people that just don't like males, or people that just don't like females, or people that just don't like people that are trying to take their jobs in their country. you know, you know, and so
Mm.
exactly. Like right now, if you were to interview for a job in America and you find a pro-Trump supporter, exactly what is happening now, you know what's going to happen to you. You are likely not to get the job because the person will be orientated in that political space. And you can be as good as you want, but because you don't identify with that person, you're likely not to get a job. So it's one of the things that are possible. I think for the people that are preparing the interview panel, it's important that you consider those facts. You try and balance it out. I'm not only talking about the race thing. Also, if you are part of the LGBTQ community and you're being interviewed in America at that time, you might be uncomfortable because the person that might be on the other side might not really like what you present as. So it's easy actually to explain this thing, even the race thing or the homophobia thing, using terms that we identify with. Might be a person that doesn't like Jews, So it can be a whole lot of stuff. It's very important to understand. And I don't know, it's one of those things that you can't control yourself as a person who's being interviewed. The interview panel might have power around that space, and you don't have power around that space. But it's one of those realities that you find sometimes.
Yeah. Yeah, I'm not sure, Tulani, if you wanted to add something to that, but um
No, I just want to say that of all the jobs that I've applied for, I've only been offered jobs at private, not at government. And I'm not being diplomatic. And maybe that's why I've
apparently
only
not.
worked for private services. But
But you're working for the government now, Chief.
Yeah.
essay, okay, in essay. But yeah, I think something that we were talking in the background about is that with regards to interview, um, in all the interviews that I've done, is that it's also nice to know if you didn't get a job, why, what are the reasons, they can detail exactly why you didn't do well in the interview, because it hurts your soul, it hurts your confidence. When you didn't get the job. I think in some of the jobs that I didn't get, that I applied for, that I wished I could get, I never got the reasons why I never got the job. And having to reflect on that, I think companies need to give feedback. It doesn't have to be quite detailed, but say maybe improve on this and try again. Things like that. I think that's something that we're talking about in the background. That's it from my side.
Sure.
Yeah. No, thanks for sharing that bit. I think the next segment that I want us to get into is just in terms of the lessons that we have learned abroad. And I think one of the things that you notice is that when you're working abroad, there's things that you see that you don't have at home, that you see a service doing, that you might appreciate. Perhaps Andrew, obviously the reason why you left, or one of the reasons, was international experience. Is there something that you want to touch on that you feel was really beneficial, or is beneficial, or that you see outside? Doesn't have to be in your current service. It might be a service on the outside that you really think this could improve our situation in South Africa, or within the district that you're working, and possibly ways in which you could make things different, either for the staff, for yourself, or just for the service as a whole.
Yeah, man. Look, I think to give justice to the question, it would be unfair to think that everything needs to be seen as a thing to take back home and change something. At times, we need to acknowledge the good stuff that we are doing. One thing that I would like to start in, it's my international exposure or coming to the Middle East, is that I got the opportunity to work with multiple nationalities, but expectantly supposed to be doing the same thing. Now, that opens your eyes, because in South Africa, it is multiple South Africans trained within the same standards, same country, competing universities, colleges, whatever, but standard is the same. One adrenaline is one adrenaline. 3 milligrams more is traction splint is traction splint. Resus is resus. If we are all paramedics, RSI is RSI. Then you come out to say, okay, let me observe myself and compare what I know and went through with my peers from other parts of the world. And I must say with confidence that South Africa produces the greatest paramedics. Period. Unfiltered. The standard of training that we are producing, it is highly comparative to our colleagues from the UK, the US, Europe, the Middle East. Actually, they look up to us. So we are doing something great and we should never ever sleep on that. We are producing great quality of paramedics which are in high demand, which we need to find a way of retaining. And we need to find a way of saying more of how we are doing our things in terms of research so that the world can know the good work that we are doing and why our paramedics so good. Whether it's a master's study, PhD study, we gotta publish. Because the difference with the rest of the world is that no matter how little the work they do, they publish. And we use their work to reference things that we know we are doing better, but we are not just putting it out there so that they can use our work to better themselves. I don't know if I'm making sense. The second part that
Definitely.
I feel we could literally learn from the international space is the use of technology. The Middle East pushes the use of technology. I mean, there's certain things and gadgets that we have here that in South Africa, if we can get them, will make this massive workload of hours that we are having in terms of call volumes much better. The issue of remuneration and literally taking public servants to be remunerated well. It's something that we see in the Middle East. It's a non-negotiable that people must be remunerated well, and so that they can meet their daily needs, so that they can focus at the job at hand and not any other thing. I'll make an example with me. My employer doesn't allow me to work outside of my employment service. I don't. I only work for my employer and my employer only. I cannot have any other revenue stream when I'm in the Middle East. There must be one check and it comes from them. And he makes sure that that check is bloody good so that I don't have to look at any other things. So imagine if we can get our own people in South Africa being paid so well that the only thing they must focus on it is to deliver the quality of work that they're employed to be doing. Just imagine for a second, a police officer, a nurse, a doctor, he does not have to moonlight. He does not have to take bribery. He must just execute his job the way that the government wants him to do. You've turned this thing around, my brother. You've turned it around. A paramedic that does not need to work extra shifts at a private facility so that he can make a living. His is to come to work, look at his patients, and focus on them. When you say he's going to rest, he genuinely goes to rest. So you are dealing with issues of burnout. You are dealing with issues of all of these negativities that affect his proficiency to work. So for me, international exposure has opened my eyes that, those two things for now. Those two things for now.
No, that is very precise, and I think the remuneration part of it speaks volume. And I think just enabling someone to focus on their job and nothing else. And I think that's something that we can possibly all learn from. All nations can learn from. Just to ensure that people are first, sort of like rewarded for the work that they do, so they do it even better. Tulani, seems like you had something to add there.
Yeah, thanks, Elias, for that. Because I was gonna forget. By the way, I'm coming from night shift, so I'm tired. But I think having to listen to Andrew, um, when I left SA, I did detail why I left SA. It was just mainly for the reasons that I've stated. But now that I'm here, something that he also mentioned, and when I reflect on it, is that you kind of have that international experience where now, if you had to go back to your home country to service the community, you can contribute effectively in terms of innovation, bringing new ideas. But I think one of the things that I've learned, especially in the Middle East, is that people get to do what they get paid for. And what I would explain is that you're there to treat the patient. You're not there to fix a car that is missing a spare wheel, or you're just there to treat the patient. You're not there to follow up on the crews. If the crews are not doing what they're supposed to do, you report them. Obviously, you may reprimand them if they're not willing to change their behavior. You tell somebody that is senior, they can manage it. But if there's a problem with the car, if there's any other operational challenges, it's not my responsibility. And I think that separates you from all the other admin stuff that you don't want to do. When I compare myself when I was still working for a private company, amongst patient care, there was also admin stuff that I needed to do. And that takes away the passion that you have for patient care or patient treatment. And I think that's one of the biggest things is that when I joined the EMS, I didn't know about the admin, the paperwork that comes with it. But what I was passionate about is patient care. And that's what I think that's something that I've learned and I'll take it, that there should be people that are designated for certain responsibilities. But obviously, it comes with, finances to the company. Can the company afford to have those people? And just one more thing, now that I'm thinking about it, is that, and this is from my personal experience, that when I was working for a private company, I'm not going to mention that private company, but they used to send you from far cases. Day shifts I never struggled, but night shifts I used to struggle because I'd drive a lot. And there was a time when I was driving, I fell asleep when the traffic signal closed. I know in SA we say robots, but I've learned here in the Middle East you say traffic signals. When I got at the
Welcome,
robots,
welcome, Habibi. Welcome, Habibi.
Welcome to Dubai.
Welcome, Habibi. Welcome.
when I got at the traffic signal, I fell asleep because I was tired. And I may be joking about this, but I was tired. And what made me to wake up was somebody hooting at the back to say, "Wake up, the traffic signal is green." And then I started driving. That power nap was good for me, but is it good that
Power
we
nap.
sleeping? Guys, I was
You will not
tired.
sleep again from there on.
I was tired. And having to reflect on that is that as in SA we refer to as emergency care practitioners or ALS, advanced life support, which fall under a big registration category. We work alone in the response car. It might look cool when you're newly qualified, but as time goes on, you realize that one of the dangers is driving alone. Whereas in the Middle East, you don't work alone. You work with people. You've got a partner. No, you don't tend to talk to yourself as if you're going crazy. You've got somebody to bounce ideas, patient treatment. You get to discuss. Okay, we're going to this case. What is our plan? And I think that's something that needs to be incorporated in the EMS. I mean, there's people that have worked in the ambulance service in Gauteng that they work in the ICU. They've had partners, and my interactions with them, they'll say that their experiences was good to have a partner. But also in Cape Town, there's something that University of Johannesburg does. It's called an elective. I don't know if Andrew you did the elective, where you have to work, I think, 200 kilometers away from the University of Johannesburg. I went,
Yep.
my elective was done in Cape Town, my first time on the plane to Cape Town. Just to
You're
summarize,
privileged.
Who paid for it?
You climbed on the plane when you were a student. You're
my aunt,
privileged.
my aunt,
So,
my aunt paid
you're
for it.
privileged. Doesn't matter. You're privileged. Acknowledge.
Just
I'll
this
take it.
once.
I'll take it. She did a lot for me. Even that Woolworths bread, if she's the one that
Hey, the
Yeah,
paid.
the
Woolworths
one.
bread.
So she was taking good care of me when I was at university. And
I know life
I'll be
was good.
forever
Chief, do you know
grateful.
jungle oats?
Movite.
Maltabela, Chief.
I think it's
Maltabel.
Movite.
That's like
Movite.
5 rands or something. You eat for the whole week.
We used to buy jungle oats. Jungle oats.
I think jungle oats is even expensive.
No milk, no milk on top. No jungle oats
Oh,
and sugar. Chala. Go. You will eat
There
again
were
when you come back.
struggles.
So
Look, there were struggles. I mean, I had to survive on a minimal, I think 300 to 500 every month, but my aunt also assisted. She played a big role in terms of me being a paramedic, the person that
with the
I
Woolworths
am.
bread. With the Woolworths bread.
You
The
need
Woolworths
that
bread is the
because,
motivation.
and a
It's just
flight
motivation.
to Cape
Yeah.
Town.
guys, you'd go to Soweto, she'd buy food for you, and you take it to Res. It was good. But anyway, to
Woolworths bread,
say,
not
to
anything.
summarize,
Not box.
That bread needs to
Woolworths,
last 2 weeks.
private school
anyway,
bread.
so my aunt, may her soul rest in peace, Betty Nkoma, she paid for the flight. She assisted to go to Cape Town. And when I worked in Cape Town in the metro, I found um, advanced life support working in the ambulance. I'm like, what? We don't have this such system in Joburg. But for me, at the time, I was still a student. I got to understand that it's always nice to have someone to work with, especially when you go to critical cases. You're not alone. It contributes significantly to patient care. And this is a system that mostly exists in the Middle East, where you work with a
Mhm.
partner and you work as a team. You're not working alone, and you don't fall asleep at the traffic signal. Yeah.
Yeah, true, true. That's
No,
that's a
that is
brilliant
good.
observation. That's a brilliant observation. I agree fully with that. That's important.
Yeah.
The
Yeah.
safety aspect as well. The safety aspect.
Yeah. I'm assuming that Elias is going to ask me to talk.
No,
Jump
no,
on
there was
it.
this
Why not?
guy that
Ah,
said, when you assume
automaticity,
me,
automaticity.
All
Yeah.
right.
but I'm not going to
So,
say it.
all right. So I know that this topic is very close to Andrew's heart because his research it talks about the early starting of your career and
Clinical transition.
the transition and like understanding
Yeah,
that sometimes you have to do leadership, administration, and stuff like that. But we are going
sure,
to talk about
sure.
it some other time.
Absolutely,
Yeah,
absolutely.
it's a very interesting space. I think, as Andrew also said, that we have to appreciate the quality that we have in South Africa. As much as we do have sometimes the technology, but I started using a tablet to do my cases while I was working in the private sector in South Africa. It was around 2012. That's when I started to use a tablet to do my cases. So the ECPR was there. And I remember the navigation system, the case used to come in, you press go, and then you drive, you go there. And then the details in the GPS will have the name of the patient that will be transmitted to your tablet. Um, as I said before, it's still not here where I'm working in Australia, in South Australia to be specific. It's still coming. I know that today there was someone who was actually at work who was trying to do like a study, whatever, in line with that. So my point is in that there are some good stuff that are happening there in the private sector too. The critical care that we offer to patients there is something that I think I'll forever be proud of. Like the Hamilton ventilator. It's actually been introduced in some of the EDs here this year, and I used that 2016
So where are you, by the way? Are you in somewhere in Africa, Congo? Hamilton T1 in
yes,
2025. You oaks.
yes.
Where are you? For the
For
record,
reference.
so that it's not Africa. Just tell
Let me
people
not.
you are out of Africa.
No. I'm in another continent. In a what do you call it? A developed world, in a first world country. as we call it. So as they called it back in the day. Anyway, so my point is in that they're still introducing them, they're still trying to understand the system and stuff like that. So there are spaces where South Africa is advanced, and the privilege of working in the ICU ambulance that has an incubator where you put preterm babies, it's that's a lot of work. And it's a critical care space that I really didn't appreciate as much as I do now, because seeing how serious they take it and how glorified it is here, so it's one of the things that I do appreciate. I agree with both you and Andrew and Tulani in saying that there is some great stuff that we do in South Africa that is not done anywhere else in the world. I think operationally, one of the things that I think I would like to see being done, it's two things. I would say understanding that a person that works is firstly the biggest asset that you have in the organization, and it's one of the most expensive commodities that you have. You spend a lot of money on them. And also, if let's say you buy a Mercedes, a car, as your ambulance, you have to service it. It has tire problems, it has oil, and sometimes they use AdBlue and all those things that it uses. There may be mechanical issues. Similarly with the human, such resources, a person must have a break too, give them, they deserve that. And mental health, you're dealing with a person, interacting with patients, you're seeing death of babies, you have pregnant women that have issues, you have domestic violence, all those things that affect you. I think that part too has to be taken care of, and it has to be valued in EMS. I think that would be a great improvement that I would like to see happening in that space. I think basically valuing a human because they are a human, and just not push, work. You do this, there's a call, you do that. And if there's a time where you want time off, it is frowned upon. If you're sick, you're sick. And then operationally too, I would like to see, I work in a country town that is far from the main city where there's a level 1 hospital. We don't drive to the level 1 hospital. There's a flight that normally takes patients regularly. You might have between 1 to sometimes even 5 patients that are flying out. It's a small aircraft, take 2 patients, they're flying. So basically the care that is seen by people in the rural areas is also, they try to ensure that it's quality. It doesn't matter if you have a heart attack in the rural areas as compared to the city. You still get the quality of care. So basically, a person in the rural area still matters, and they are still valued as a human. The human rights that apply in the city are the same human rights that apply in the country. It mustn't be because you had a heart attack in KwaDukuza or KwaNongoma or somewhere in the Bundus in Wanka Wanka. I like how jumping people say that. Yeah, whatever country town that you are, I think it has to be the quality of care that you receive there must be the same quality of care. Mustn't say ambulance is coming from Mpangen to Mhlabi-Alinga. It's going to take 3 hours to get there. Heart attack is a heart attack. If it happens in Joburg, it's a heart attack. If it happens in Mhlabi-Alinga, I think all those things, or even if it means you bring the ambulance station closer to the people, you have to do all those things, have to take care of the people. People are people no matter where they are. So basically, those are the things that I would really like to see changing if there was an opportunity in our healthcare system, pre-hospital setting.
Elias, can I write on 2 things? There's 2 things that I've just noted here on technology. I'm a practical guy as well. You'll see I'll write things down.
Don't worry.
We know
Yeah.
I'm seeing a pattern. You and Melusi, like the Grootman.
That era.
Yes, we're right. Yes.
I write things down. So, I write because I know I'm gonna forget, and I don't want to tell people I'm about to forget. Can I speak? Let me write it down. So the issue of technology, Joe, imagine this. Imagine an ambulance having technology of navigating to a call, an ambulance having live tracking, an ambulance having cameras to monitor safety, and to be able to be monitored remotely by the actual control unit, not only for call taking and dispatching, but somebody has a screen of all these ambulances. No matter what challenges they have, somebody's looking. Imagine the turnaround it will have on paramedic attacks, all of these things that we are seeing as a catastrophe in our country. That you know that there's a dash cam, that somebody's monitoring me as part of their daily duty. His job is to look at these cameras and make sure that things are fine. Where there's issues of safety, we trigger the response to support these particular guys. Imagine all of these stories you are telling, ventilators, neonates, training successes, all research being done and published. No matter how small, man. The use of ventilator X versus, NeoPav T1, what has been the outcomes. And we start to get the language going, and put South African emergency medical saving more and more into the international space. I'm not saying we are not there, but let us be honest. Australia, New Zealand, Canada, papers. Those guys, they literally write papers about any and every little thing. But we come in here, we look at how they train their people, we compare ourselves against those standards, and we realize, actually, we are better. Are we not just downgrading ourselves with the quality of work that we are doing, and only expecting that academics must go to conferences once every whatever, go tell them about that little bit of study that they are doing? So we should really be saying, even in the operational space, and I hope you do take on invitation of the gentleman by the name of Dr. Nasif Abdullah. And that is what he's trying to say. He's saying any little thing that is happening operationally, let us go out there and make it well known and publish it and show the world what we are doing. Because the park, he was bitten by the park when he was here, realizing that no way, man, no way, we are doing so much, but the world just does not know about it.
So, Andrew, and maybe I might be putting you in a compromising position here, but also anyone can also answer this. I feel, because I was in South Africa recently, and I feel we're slightly getting there. But I know the private services, one particular, is leading in terms of technology, having the stuff that you mentioned, cameras, dash cam that can monitor the crew. And they had it, I think, since when did I leave? Since 2017, they started introducing the technology, whereas with the government services, it's slowly but getting there. But one of the challenges that the government services are encountering, and I don't know what are your thoughts, is the tender system. Um, I only thought the tender system only existed in South Africa, but having
No,
working abroad, I realized,
no,
okay, tenders are everywhere.
sure,
But the tender
sure.
system gets awarded to people that not qualified to actually offer service to the government services. Now, the question that I want to ask, I know Elias is running this, but in terms of the tender system, don't you think that the tender system, more sticking to the EMS, is affecting the service delivery that we can offer? Because of instead of buying like Hamilton's, they'll go for a cheaper brand, or they'll get a service provider that provides a service at a less fee, but providing substandard equipment, or equipment that is not even efficient to cater for the EMS service. Having you
Uh,
worked,
my
yeah.
My brother, I worked in the public space, and I'm gonna refer again to this gentleman. May his soul rest in peace. That guy showed us that it's not the government, it's the people that are driving the process that are the problem, not the tender system.
Yeah.
Yes, the tender system is not perfect. It has its limitations. During Malevana's time, may his soul rest in peace. That man was able to show that you can make things happen. Literally demonstrate. Go to Gauteng EMS and ask them. T1, Hamilton T1, we had those. And I'm talking 2019. With low
2016.
birth weight, 2016, with low birth weight barricading accesses, those KPI, because you had to unlock those things, We're talking incubators. We're talking making sure that the ambulance design that is currently used with those beautiful things at the back, you know, those beautiful clouds, blue, white. Well, that's the man's innovation. To say, why should we have a white ambulance that is so dull? We started piloting it on a neonatal ICU and obstetric ambulances. It takes understanding what you want to achieve and being very clear, and you must be intentional. But if you are going to run a system and not understanding what needs to happen, not being intentional about it, you are going to frustrate the people and find for excuses. And one of the biggest excuses that government official will ever give you, it is this thing called tendering system. A tender to be awarded, there's a process. For items to be on the tender list, there's a process. There are people that actually say, we are going to take this item and put it in there. Then who are the users of this item? Come and become part of this adjudication, whatever, specification, whatever, to make sure that this item is going to be on the list and you are going to buy and use it. That's why you can see that we have crafters. We had crafters as ambulances and all of these beautiful vehicles and stuff. Why didn't you have the nonsensical Isuzu or what is this thing, a Quantum as an ambulance? We never had a Quantum as an ambulance. But we had big crafters because people were intentional about it. You see what I'm going? So I'm saying, my brother, as much as the tendering system is an opportunity for corruption and all of this bad stuff, but it is not actually the only problem. If you don't know what you want to achieve with the role and responsibilities entrusted upon you by the government, you are not going to lead the organization in the right direction. Therefore, you are going to not achieve the right things. An example and a point in case is the Malebana when was the director. He knew exactly what he wanted to achieve. What kind of an ambulance? What kind of equipment? How am I going to go about it? The teams that I set up to get these things going, and we go and make sure we get them. Gauteng EMS had the best equipment at one point. Private companies, they were drooling to some of the equipment that we drove GTIs, chief. We drove beautiful cars, equipment, world-class equipment. So it's leadership. It's the leadership problem. Let us not also, look at the systems, but that's a leadership. It's a leadership problem.
Yeah. Well, a lot to uncover there, and a lot to sort of like think about. And I think I agree, because I think I was part of few tendering systems at the university as well. And you state what do you want, the procurement system would obviously execute it, but then you have to be very clear as to what do you want. And you look at the options that are coming through to say that no, we're not going to be buying this. It's cheaper. We understand it's cheaper, but that is not the quality that you're looking for. We're looking for this specific equipment. This is the manner they need to follow up with, making sure they service it and make sure that all these clauses are within, whatever part of the tendering process or before you go for tendering process. I think just because we're running out of time on this as well, I think the next section that I want to move on to, and I just want to say, with regards to the comment that was made earlier that South African paramedics, the quality is great. And I think I can attest to that because I've worked with a lot around the world, in the US, in the UK, here as well. I think most of the paramedics that work in New Zealand on the helicopter are South African, because they are the critical care paramedics, and it's an opportunity to speak a little bit of Afrikaans, or just say, hey, where did you work? Oh, I work in Namibia. Oh, I was in Namibia at some point. And they are global; they are everywhere. So I think that speaks for the quality. And I think just my last section of this is just obviously now we are having two generations. The new generation, a little bit of it is taught online, a little bit of it is demanding for a bit of a different system. I think, how do we merge the two? How do we ensure that we maintain the quality? I know that we speak a lot about, being proficient in your work and what you do. What do you think about online education and, sort of like how can it contribute? Because obviously you're experiencing the dimension of the education system now. And yeah, what are your thoughts on online education and how can it complement the system that we already have? Do you think some modules should be moved online, or do you think it should still be in person?
Sure. My brother, blended learning is the future. No twist to it about it. And when we talk blended learning, we are talking the mixture between online and physical. You gotta find a sweet spot. And there's no way that you can say in a curriculum everything should be done physical. It's It's not possible. COVID taught us that there are things that we can offload to blended learning approach in terms of using uh, technology, online sessions, self-learning modules that can run themselves. I mean, I did courses like Dispatch. I probably the guy that taught me I could have maybe been taught better by a computer how to take a call and how to dispatch an ambulance. We did courses like administration and management. I'm certain that some of those aspects could have been done online, and now it's even better with the access to technology and access to these things that universities are supporting students. Are they challenges? Absolutely, there are challenges. You must get a gadget. You must have access to internet. You must have access to electricity to charge the gadget, and so forth, and safety to be able to use it off campus. Those things they actually affect the efficiency of blended learning. But on its own, it is quite a move into the future to approach blended learning. You are not going to do a blood pressure, my brother, on the computer. You must go and see a patient by the side of the on the bedside. You are not going to say, I have intubated 10 mannequins, I have proficiency in intubation. You gotta sit flat on your stomach on the side of the road and put the tube into somebody's vocal cords. You're not going to say, I have delivered a baby on a mannequin. You gotta go to that ops unit and go catch that particular baby. So what am I saying? I'm saying that blended learning, its philosophy says, take what is it that does not need physical interaction with the teacher, leave it to technology to run. Take that requires physical interaction with the limited resources of teachers that you are having and make it the core function of these teachers, and have the ability for students to reference to a human being when they are going through this technology-driven learning. So blended learning is the future, and we can't argue. We definitely cannot argue. As a teacher at heart, educator at heart, I am for blended learning.
Yeah,
Gotta know
no,
what you're
no.
doing. You gotta know what you're doing. If you don't know what you're doing, you're going to take EMC practicals and want people to now look at mannequins and videos, and you don't know what you're doing. But can I teach you asthma pathophysiology with a beautiful video? And absolutely. But you need to listen to somebody's chest, to listen to wheezes. Yeah, you gotta put your stethoscope on your ears and go find those chests and place the stethoscope to get to understand those things. But you don't have to start there. You can start with the computer that shows you a model. This is what asthma is all about. This is the degree of occlusion that is happening or bronchioles. This is all the pathophysiology. Beautiful model. Application site. Blended learning, my brother.
No. Yeah, definitely. I think we are running out of time. We are exactly in 45 minutes. Gentlemen, Tulani and Malusi, is there anything you want to add to blended learning in terms of, moving into the future in terms of paramedic education?
Okay, I'll be
Well,
quick.
okay.
I know Melis is going to take long, so I'll be quick. I think knowing you, Melusi, knowing you, I think, look, you guys know my sentiments about my thoughts and feelings about blended learning and my experience. Unless things change, I just want to say that maybe blended learning should be targeted for specific students. For someone who's studying at a university from first year, with the introduction of technology, all the other stuff that Andrew has mentioned is that it might pose some challenges within the first few years, but also the students are not matured enough for blended learning. Because if you look at the education system that some of them are coming from, it's a face to face. So maybe for the older, mature students, blended learning can be something that can be introduced. But I still feel that with my one experience, I don't have much of that. Students didn't take it seriously when we had online sessions. Whereas, what I see is that with postgraduates, online learning, it works beautiful. But for my experience with the undergraduate students, especially because I dealt with most of the first years, It was not something that was productive, and didn't want to participate mostly on the online sessions. Yeah.
Can I just ask you a question before you step off? You know,
Yeah.
and I'm probably your experience. I watched the show, that session. It's based on the COVID when everybody was shocked and gotta find solutions and how to do this thing.
Yeah.
Uh,
Hey, I'm glad
I
you
can
watched
assure
that.
you,
You watched. Yeah.
I gotta do my. I tell you, when I do something, I do it good. I do my work. I after
Yeah.
I have watched all the shows. So blended learning, or COVID shocked a lot of people and found institutions of learning ill-prepared. Therefore,
Yeah.
they had to find something quick to deal with the crisis. But if we are going to do blended learning as part of the curriculum, we actually plan it, how we are going to execute it, what support mechanisms are we going to be putting in place, and we also acknowledge the kind of learner that is going to be using this thing. So it is a curricular design, it's a program design, it becomes part of the integrated delivery model. It is not seen as a what needs to happen, they can't just be at home bored, let's do something quickly. That is the one aspect. The other aspect is that the challenges of those that are coming from deep far, underprivileged schools where this access to technology was not there. It is the
Top
responsibility
100.
of the curriculum designer to ensure that they support those and an institution itself. However, we also know that our kids are tech savvy than us. There's a lot of things that I struggle with that my son and daughters can run away with it. So we ought to give them that particular platform to really excel in that space. And funny enough, research is starting to show that they prefer it that way. They literally prefer it that way, to sit on their gadgets and do the things. Whether we'll see in the future a negative outcome out of that, it's something debatable. But they are quite tech savvy and they are literally quite receptive to this kind of an approach. And the responsibility to learning should be instilled in any model that you are giving to the student. You can have a student come into class, sitting in front of you and not doing tech focal and still not learning what you do. So learning, it is a give and take process. It is a responsibility of the educator to afford learning opportunities. It is the responsibility of the learner to interact with those learning activities or opportunities meaningfully so that learning itself can have a positive outcome.
I think, Andrew, you make valid points, and the only thing is that maybe we still need more. Once blended learning gets introduced, we need to find out, is it working, is it efficient for the students, um, and then we can take it from there to say, okay, maybe the future is for blended learning that can be introduced. But as of things that we've always had, that one model of teaching, which was face to face.
Absolutely.
And that's something that we've done, especially. And also, we need to take into consideration is that a lot of these things that are working, is research being done in the international spaces in the first world countries. I, I, I might be naive to say this, but I haven't seen a paper that says that students did well with online learning, especially during COVID times. But I've seen papers or even the students' interactions when you ask them questions, when you start to engage with them in terms of one-on-one on how they performed. But I think
Nazo,
maybe for
Kata.
future research would be
Yeah, good.
blended. But I hope the future training would be more on research will focus on, is blended learning assisting students in terms of purchasing students that are well understand the medicine that they've been taught. I think there's something that is missing. Qatar is back.
Yeah.
Nazo.
Yeah. And I think just before I allow Malusi to add his thought into it, and just remember, most parts of the world are doing it remote. I think there are ways to facilitate it. I think like New Zealand is doing quite well. I mean, not completely remote, but you don't have to. You have contact sessions or block sessions in which you do your practicals and even your placements. And I think what probably helps them a lot is that there is quite a lot of, like, for instance, if you are an EMT and you have to get onto the paramedic program, you must be working as an EMT full time for a company before the university can accept you. And I think that kind of like helps you, because when you're working with paramedics. But I guess it has a space for it, and the responsibility that's being put upon the paramedic is also very different in New Zealand compared to what responsibility the paramedic in Namibia or South Africa has. So, but I think it has a place for it. I think it's just, as Andrew said, do we have the infrastructure? Do we have the resources to make sure that we equip
Sure.
these people adequately? Is the system allowing them, or are we sort of like, tiptoeing into it and hoping that they'll adapt to it? But yeah, Malusi, I'll let you share your thoughts.
Sure.
All right. So
Sure.
I've had the privilege of being an academic casual at one of the universities here at Flinders Uni. One of the privileges, it allowed me access to mark certain scripts for students while they're doing their assignments. One of them was actually in blended learning. And what they did was they were doing videos. So there would be a group of, let's say, 3 or 4. They would be making videos of, let's say, anaphylaxis. They'll discuss it from pathophysiology and signs and symptoms and treatment. One person will be responsible for the other, one person will be responsible for the other. And actually, you could see the differences in the age groups. The younger people, you could see this one as a TikToker, they know exactly what they're doing, and the video will be amazing. And if they are a little bit older, you'll see the video will be
Grootman.
yeah, Grootmans, the video will be a bit dodgy from a phone that is also old. You can see that from the video, the quality. But you'll be surprised of the quality of content that you'll be the quality of content that you'll be seeing from the learners when they're doing those videos, because they give a lot of effort. And you see, when you're marking, you see that this is quality stuff that you can use this video to teach someone else about this content, because they've put a lot of effort in that. I think that concept is similar to what we used to do assignments. When you're typing an assignment, you'll go and research about the topic, and then you type it down, and then you'll be in an assignment, then you get a mark from that. It's similar to that. So there is room for blended learning. There's definitely a room for that. I think from what Elias was also saying, there's a program that I know of whereby a man on the streets, let's say a BAA, is hired as a BAA, but they must do the BAA and they must apply to university. They are accepted to the university, and once they're accepted at the university, they get to be full-time employed by an organization. They study online and have some contact sessions in between. Let's say you have a contact session every 2 months for a week. So every 2 months for 10 months of the year, you're meeting for a week. And in between that, you're having those online sessions where you're learning. And you end up finishing your degree doing it like that. So the advantage of that is that you have a person that goes to work. When they go to work, they go to an ambulance with a person that is qualified every day. That person is mentoring them, guiding them, and getting them the skills that they want until, let's say, you finish your first year. After first year, you finish, you can cannulate by the end of the first year, because you've learned it at school, you've learned the theory online, and then you have a person that is guiding you, mentoring you at the same time. So you have mentorship going on there. You have learning that is happening online. You're studying, and then you have contact sessions on how you learn the skills, and then after that you practice. So what Andrew was saying is that you need to listen, you need to deliver the baby from a mannequin, and then after that you deliver the baby on real life. That's an experience. That's what you get from doing those programs. So my point in that is, look, there are programs out there that are not like your traditional universities where you sit in front of the class and you learn. They are out there. We can learn from them. If we say that we have less paramedic output produced by the country, we need to start thinking about those opportunities that are out there. We do need to think diversify and not just be focused in creating critical care rescue clinicians like we are doing currently. I don't think I was longer than you, Tulani. I'm done.
It was, no,
Yeah.
5 minutes.
Yeah. I think
So yeah, yeah,
I really do appreciate your input, everyone, gentlemen, and I think it's obviously we're ending off with blended learning, but the whole
blended learning, blended learning.
yeah.
Not
Yeah, I
not
think it's
hybrid,
definitely
not hybrid. The term is not hybrid. There's hybrid. People that they talk about, no, okay, it's blended learning. The educational term is
Yes,
blended learning.
health
Yeah,
sciences in education. I think it
yeah,
helped there
health
to
science
assist.
education,
Yeah.
and there is research done. Gents, blended learning. It is a mode of curriculum delivery, but the content and objectives of the curriculum must still be met. You determine for yourself what is the most efficient ways to deliver that content and to meet those objectives. Blended learning, it is just a modality. And there are advantages and disadvantages, just like lectures, just like working experientially with a mentor. All of those things, they've got advantages, disadvantages that you need to be able to explore, that you need to be able to have to develop room for in terms of delivering of these things efficiently. So he made an example of somebody that works. Again, you work at a mentor. It is an area you need to control. Who are you working with? Is that person willing to teach that person? Does he know what needs to be done? How does he give feedback and develop the person? Can you see? It needs to be intentionally managed so that this guy, when he goes there, he doesn't eat a burger, donut, smoke, and talk about the game yesterday. But his learning, it is still continuous. So delivery of a program, it's scientific. The problem with us as paramedics and doctors, we think once you have retained your bachelor's as a paramedic, you can teach. Once you have done your MBSHP, you can teach. No, teaching is a profession and it ought to be respected, and people must explore so that our health sciences programs can start to take the innovation of all these other programs are taking in the world. It's a profession. It's a competence. Am I making sense? Until you dwell
Yes,
into
teacher. Yes, teacher.
you are going to refer to what they've done to you. You are not going to explore the possibilities. And that is what I have had to learn when I went to do these things. That teaching is a science.
yeah, Grootman. I think we can. I think you can agree. I don't think we have enough time to cover all the things that we could possibly talk about. But Andrew, thank you very much. We appreciate your knowledge. We appreciate your experience and the wealth of information that you have shared on the podcast. Would like to have you again, hopefully soon. Uh, I know it was, a bit of time
After I
trying to
buy you a
match all the
laptop.
time zones. Yeah. Trying to match all the time zones, but we really appreciate you. Thank you very much. This is the end of podcast number 2. Please do like, subscribe, and share this with anyone else that you think might like the content. Thank you very much, and this is us out.
Thank you. It's an honor, Chance.
Peace.